All right. Hi, everybody. My name is Rebecca Picasso. I'm the Program Director for the California Telehealth Resource Center, and I'd like to welcome you to session number 3 in our Telehealth Summit webinar series, Grant Writing Overview, Tips, Tricks, and What's Available. Our presenter today is Dana Satterwhite with Learn, Design, and Apply. Dana, if you could do the next slide for me. Few things before we get started. Please use the Q&A function if you have questions that you'd like to ask. Use the chat function for any kind of funny comments or technical or logistical issues that you have. If there's time at the end of this presentation, we will do live Q&A. If not, we will make sure that all Q&A is answered and posted to our website later. The session is being recorded and your attendance is consent to be recorded. So if you don't want to be recorded, well, you might want to log out. The recording and of course the presentation slides and again Q&A will be made available probably by the end of today. I know it says it on the slide. I'm just going to promise it. I'm going to hope I keep my promise, if not first thing tomorrow morning. And it can be found on our website under the Telehealth Summit sessions. So with that, I'm going to go ahead and give it over to Dana.
Thank you, Rebecca, and thank you all for spending some time with me this afternoon, and thanks for joining. As Rebecca said, I'm Dana Satterwhite. I am with a grant consulting firm called Learn, Design, Apply, Inc. And today I'm going to be talking about general basics around grant funding, tips and tricks, best practices, and then I'll go through some relevant grant programs that are either out right now or expected out soon in the telehealth and healthcare space that may be of interest to some of you. So here's a quick agenda of the topics I will cover. And as Rebecca mentioned, I look forward to fielding any questions that you may have. I also will provide my contact information if you want to have a more tailored discussion around your specific needs or potential grant proposals. And I would love to learn more about what we might be able to help you with in the future. So as I mentioned, we are Learn, Design, Apply, Inc. We are a grant consulting and management company. We have a ton of experience specifically in grant management and writing, and we specifically focus on technology initiatives. Our specialty is in federal funding, and we have done a ton in the healthcare space over the years. Our job as consultants is to research and understand the funding that is available and coming out. And then we can be kind of as involved in that process as you want us to be from a support perspective. So we can help you from beginning to end with building your application. We can connect you to the funding resources if that's all you need help with. And then we can walk you all the way through the application and implementation process. So again, as involved in that process as you want us to be, but we are here as a resource to help you all understand and navigate through the complex world of funding. As you all are probably tracking very closely, there's an unprecedented amount of funding right now, especially focused in the telehealth world with COVID relief funding, and in general, our shift as a country to doing as much as we can remotely. So there's a lot of funding out there that actually doesn't follow sort of our traditional history of tracking discretionary and competitive grants, but also looking at allocations and understanding trends in funding and where to go to access some of these funds. So in addition to kind of walking you through what we can do from the application perspective, we can provide just general information, point you to resources and different areas to look for funding. The more we know about what you're trying to accomplish and what you're trying to do at the application perspective, the more we can help tailor a search to finding funding for your specific needs. So I encourage you, please feel free to go to our website or reach out if there's anything that we can do to assist you with your funding journey. And with that, I'll kind of jump right into some of the best practices. In general, our team kind of lives by a mantra that we say, follow the money. We learn what trends we've been seeing across the country, and we understand that a lot of those trends, with those trends, the money will follow. So obviously, top of everyone's minds right now is COVID-19 response funding. We're seeing it in all kinds of different forms. Like I mentioned earlier, a lot of this funding is coming by way of allocation. So it comes from the federal level, then goes to the states, and then the states distribute into different buckets of money. So in general, just understanding where that money is, what the priorities of that funding are, and how do you best align with your state agency or entity that is managing that pot of money in your community. Additionally, we've seen over the past few years a big focus on anything related to the opioid epidemic. Mental health services obviously also fall into that category. We see a ton of funding continue to be put into that area. So just understanding those trends and what types of project priorities you would want to make sure you list and how you substantiate your request within a grant proposal. And then we are seeing a ton of funding in sort of the violence prevention and school safety areas and bringing school-based health into the schools. And I think we'll see that trend continue as schools are navigating that difficult transition in the distance learning venture. And then again, as they look ahead in the future and start bringing in students back into the classroom, bringing in some behavioral health services in those environments, I think will be a trend we'll start to see more and more of as it will be needed. And then in general, many of you are probably tracking and aware of some of the FCC funding we've seen for healthcare. We've seen some in the form of COVID response funding, in addition to FCC healthcare funding in general. So we are following that and tracking it very closely. And then again, things like teledentistry and rural outreach in the telehealth space have always been big topics and trending in general. And then again, with the pandemic, we're seeing that become increasingly important, trying to find ways to bring resources to rural communities without necessarily doing in-person consultations and in-person appointments if not needed. And then we always see a lot of funding in the healthcare workforce development area. And again, with COVID-19, we expect to see a lot more of that. So in general, again, we follow the money, we understand the trends that we're seeing and looking at where they're going to be putting priorities and focus areas for some of this funding and understanding what's going to make your applications highly competitive and how do you justify exactly what you want in your grant budget based on these priorities. So a lot of what we do, and I mentioned our team tends to focus on, in the healthcare space in particular, grants that focus on technology. That just happens to be our area of expertise. That being said, most grant applications aren't going to be super focused on the actual technology details. It's rarely about what it is you're actually requesting the budget for, and more about why are you requesting this and what problems are you addressing in your communities? What are the challenges you face? Talk about those problems, talk about the demographics and the communities you serve. Maybe there are geographic barriers to preventing some of your patients getting to healthcare facilities and resources. So the telehealth component is how you address those challenges and needs. And that's really in a grant space what you focus on. You start with those problems, you start with the communities you're serving and what challenges you're facing. And then you articulate the benefits of what you're proposing in your grant application as part of that solution. So you don't typically spend, a couple hundred pages of your grant narrative talking about the actual technology details, the ins and outs of how it works. You talk about why you're requesting budget for these technologies and what those technologies will help you accomplish as your mission for those that you serve. And our biggest thing when it comes to grants, especially when we're looking at so many different types of funding and different programs, we never want to force an applicant to go for a grant unless it's absolutely the right fit. We don't want to try and cram our agenda into a grant proposal when it's very clear in the grant guidelines that it's got its own set of priorities. And if your priorities don't align with those guidelines, it is better to wait for the right grant for you than to try and tailor your project to fit what the grant is asking you to do when it doesn't actually apply to your organization. Grants are time consuming and they can be a lot of work. So you really are better served if you go for a grant that really is in line with what you're trying to accomplish. And in many cases, that means you might go for several grants to build out one cohesive project. It's rare that you'll find one magical grant that meets all of your needs in one fell swoop. So we like to build out a strategy and a plan around your whole vision, and then we find different funding mechanisms and vehicles to help you accomplish that full vision. In many cases, grants will encourage you to have partner organizations. You can establish those partnerships in the very beginning, before you've even identified what grant you're going for. If you have an idea of what your overall vision is, say for a telehealth initiative, there will likely be project partners involved, and you can start establishing those relationships and partnerships right away so that you have them in place before you even begin the application process. And then building out what are your goals, what are your hoped for outcomes of your project, and start to look ahead at what it will take to get you there. But again, the most important thing is to look for the grant that's the right fit for you. And that's something that our team can absolutely help you with once we understand what your specific needs and challenges that you're facing are, and help make sure that we're finding the right grant program for you to apply for. So I'm going to jump into a few different funding opportunities that are either out right now or expected out. And just go over some of the basics, just to give you a taste of the types of funding programs that we are seeing. Again, this is not all that's out there, but just given what you're here to kind of learn about, it sometimes helps to look at specific grant programs and what their priorities are to understand how to approach these different funding opportunities. So many of you probably saw the FCC put forth the COVID-19 Telehealth Relief Program. It was due about 2 months ago, and it was a very, very competitive process in that there were only a set amount of funds, and it was basically first come, first serve. And because of how popular that funding program was, and clearly how much need there was out there, we are seeing that there is a proposed $400 million portion of the Access Act, which is funding specifically for expanding broadband and internet and connectivity, but additionally will expand this telehealth relief program that we saw before. And the idea is to provide healthcare providers, bring connected care services to their patients at homes or mobile locations in any way to help support efforts to mitigate the pandemic and bring resources that will support efforts behind COVID-19 response. So again, this has not yet been approved, but we do anticipate some more funding to come into this program. And again, it was very highly sought after last time. So basically, we wanted to put the word out there because it does, you will need to move quickly if you want to pursue this funding. We don't have all of the rules and details, but if it is similar to the last round that we saw of this funding, we can anticipate that the application will be a rolling deadline. Basically, you submit as soon as you are able, and they will distribute the funds until they are all out of them. So earlier the better, obviously. We have seen in the bill that they have proposed $400 million. It has not yet been approved. The last round, they let you apply for up to $1 million in funds, and they did limit the program eligibility to nonprofit and public eligible healthcare providers. So that would be your first step, is to make sure that you would even be eligible for this funding. Then there are some things that you can do ahead of time in preparation for this to come out. This particular program would devote $100 million to the Department of Veterans Affairs to support veterans in rural and underserved areas. So that would be something to consider for this round as a priority to make sure that you're meeting the requirements and the competitive elements of who they're trying to bring these funds to. So some of the things that you can request budget for are telecommunications services and connectivity, bringing broadband into areas that don't have adequate broadband for telehealth services, remote patient monitoring platforms, and then obviously hardware, connected devices and equipment, tablets, smartphones, telehealth systems in general for bringing, for connecting patients to healthcare providers regardless of location. So those are all areas of eligible services. At least they were in the previous round, and we expect it would be similar in this next proposal. So I wanted to kind of highlight these types of things because in any funding program, There will be examples of, eligibility, services, things that are priorities for this funding. And when we were talking earlier about finding the right grant program for you, those are the things you want to check first and make sure that you're meeting all of the eligibility requirements first and foremost, but then you're also hitting some of those priorities that the grant will highlight in the guidelines and say, this is important for us, this is what we will be looking for as part of the funding, and make sure that you check those boxes so that you are as competitive as you absolutely can be when they go to evaluate your application. So in the previous FCC program, this is how they did the eligibility. And some of these are steps you can take right now to register and be prepared. So you want to have eligibility determination done through USAC. Many of you, if you've done anything through USAC healthcare funding, you might already have that registration done. Obtaining an FCC registration number or SRN. And then obviously, if you've done anything through the FCC, you can use your existing registration number. And then you will need to register with what we call SAM, which is System for Award Management. And this is a platform that many federal grants will require you to have active at the time of submitting a grant application. So it's always a good idea to have an active SAM registration, even if you aren't pursuing this particular program. So those are some things you could do right now if you do think that this FCC program, if approved, would be a fit for your organization and you'd like to look into it, just eliminating some of the work you have to do once it's released. We are also aware of the FCC coming out with a program called the Connected Care Pilot Program. This one has been kind of scheduled or set to be released sometime in August. At least we were under that impression. So we do expect to see it very soon. This one's a little bit different than the COVID Telehealth Relief Program. This one is specifically a pilot program for a 3-year period to support the provision of connected care services. And it has a priority of bringing telehealth services to low-income patients and veterans and areas lacking adequate health care. So once this one comes out, it will come out with some specific criteria and requirements that make sure that you meet those eligibility requirements around that population that it's designed to serve. So again, finding the right program for you, looking at what the program is designed to provide funding for, and if you provide services within that category, this could be a great program for you to look into. So here are some of the basics of what we know so far about this program. Again, it does sound like the award size will be up to $1 million in funds per award. This program, we do anticipate seeing it having a matching fund requirement of 15%. If you're not familiar with what a matching grant is, that means that you have to contribute a certain percentage toward your project. We kind of call it like you're putting some skin in the game. So you contribute 15% and then you'll be reimbursed for the majority of the project for the remaining portion of that budget. And then again, when you see that priority of benefiting low-income or veteran patients, if your system does have that as a service and an area of focus, this could be a really wonderful vehicle for providing you some funding. Again, you look at these eligibility criteria and you look at their definitions of healthcare provider to make sure that you would be an eligible applicant. And again, our team is here to help kind of weed through all of these details and make sure that you meet the eligibility criteria and that your program that you're hoping to roll out falls in line with the grant's priorities. So hopefully we will see this one out very soon. And then another program I wanted to highlight, because this is a little bit different than the FCC program, this is the RUS DLT grant through the USDA. RUS stands for Rural Utility Services, and DLT is Distance Learning and Telemedicine. So this grant is specifically designed to bridge that digital divide and bring either telemedicine or distance learning or a combination of the two services into rural areas that have a need for resources and services that they don't have locally or at the level of quality that they would otherwise if they were in a more urban area. So we expect this program to come out early next year. We have seen this grant come out every year for gosh, maybe 15 or years or longer now, with the exception, I think, that 1 year they took off. But other than that, it's very predictable and very dependable. This year with COVID-19, they actually did 2 rounds of funding, which have not yet been awarded. But this is a grant that, again, it comes out so consistently that we know very, very well what will make for a competitive application. And our team can absolutely help you to determine if this is an option for you. Again, you would want to be serving rural and underserved communities. You don't necessarily need to be physically located in those communities, but your project design and who you're benefiting needs to be in those qualifying rural and underserved communities. And that's something that we can help you look up. This is another grant that requires a 15% match. This is of your federal request, so it actually ends up being about 13% of your total project cost. It awards up to $1 million, and then you receive additional points towards your score if you fall into different special consideration categories, like an opportunity zone, or if your project addresses substance abuse, including opioid services. Those could also be in the form of community education around substance abuse and opioids, so it does not necessarily need to be clinical or medical treatment for opioids like MAT, but it could be providing education for the community and bringing resources for the community. So that would still count as that category. On the education side, you could include a focus of STEM education and get these priority points. That would be qualified as, say, nursing programs at a community or technical college. That would qualify as STEM if you have those partnerships with those institutions of higher ed. And then in the last round of funding, we did see a tie to bringing in some additional priority if your project does focus on the COVID-19 impact and response services. I don't know if we'll see that again early next year, but I would imagine that there would at least be a place in your narrative for this grant to talk about the impact COVID-19 has had on your community and on your health system. And basically, you know, REST DLT has been around for so long. Again, they did have a COVID-19 focus as part of round 2, but in general, because it is a grant that is so specifically focused on telemedicine and distance learning, the nature of this type of application will already lend itself really naturally to a COVID-19 response effort. So you don't necessarily need to highlight everything related to COVID-19, but maybe you would talk about the response and the impact it's had in your communities, and how continuing to expand telemedicine services would continue to provide, you know, those safety measures and those extra efforts needed as we go forward and move into a more, you know, telemedicine focused environment when we can. So just to kind of go through eligibility on this program, on the left-hand column, you'll see what is eligible, and on the right-hand column, you'll see what is not. This grant is actually rare in that it is a technology-focused grant. Still doesn't mean we go into all of the details around the technology as much as we go into the need and the challenges that the technology helps to address. That being said, they do have some requirements on what is eligible in the budget, because they do want it to be focused on CapEx or capital expenditure purchases. So things like hardware. This is a great vehicle for things like a telehealth cart solution and the hardware needed to implement a telehealth system for your organization. This one does not like things like recurring costs and fees. It does not allow for things like personnel, so salaries and benefits and contractual costs are not eligible. So you really want to focus on the hardware, the equipment, and the technology, including software and licensing, that is required to get your telemedicine program up and running or expanded or improved. And this one actually, almost anybody can apply. You know, we were talking about the FCC had some restrictions on who could apply. If you are a for-profit entity, this is an opportunity. Some grants will not allow for-profits to apply. This one absolutely does. So it would be a great opportunity for those for-profit clinics and systems that serve rural and underserved communities. It's actually easier to go through who is not eligible for this program. Federal organizations are not, sole proprietors, et cetera, are not eligible Everybody else is eligible as long as you have an active SAM registration, which we talked about earlier, that System of Award Management, and also an active DUNS number. And those are all things our team can help you either register for or make sure and check and see if you have one. So just to kind of wrap up the specific funding programs and trends, these are some other programs and areas that we expect to see quite a bit of funding in the near future. SAMHSA, if you're familiar, is a Substance Abuse and Mental Health Services Administration. We've seen a lot of initiatives around school-based health and behavioral health programs, and we anticipate to see more of those in the very near future. Additionally, we always see several programs from HRSA, either to support rural telehealth networks or in the healthcare workforce area. So we see a lot of nursing education through the Health Resources Services Administration, and we anticipate that to continue to be the case and possibly even more so given the emphasis that we will be placing on healthcare workforce training coming out of COVID-19. With that, I'd love to open it up for questions and hear any feedback. If you have specific needs or want to have a conversation, I'd absolutely love to connect with you and talk about your specific needs in general. But with that, I'll kind of open it up for live questions.
All right, so we've had some come into the Q&A. So before I hit that real quick, let me just go through the last slide. So thank you guys for attending. Thank you so much, Dana, for talking to us about grants. I actually have some questions I'm going to ask too for me. So join us for the next session, which happens to be August 26th. We're talking about navigating the telehealth landscape, any pressing legal issues that are going on right now in telehealth. That's with Hooper, Lundy, and Bookman. This presentation and all of the previous presentations, I can't talk anymore, are available on our website. The link is down there. If you can't find it, feel free to get in touch with us. We'll be more than happy to direct you. All right, Q&A. Let me pull this box over. So the first question is from Mark. He said, if we were not funded last round of FCC COVID, can we resubmit?
I would absolutely say yes. I don't have a definitive answer since we obviously haven't seen the program guidelines come out, but I can't imagine that they would say you cannot resubmit. And if you'd like, it might be helpful to have a group like ours or someone look through your previous proposal to see perhaps what it was that either disqualified you, unless it was just simply they ran out of funds before they could get to yours. But we'd be happy to take a look at it and give you any feedback based on what we saw in the last round. But I would be very, very surprised if they didn't allow you to resubmit in the next round.
Awesome. So this one came from Leticia. She said, when do you expect the next proposal from the FCC to be available? And I know you talked about 2 FCC grants. This came in when you were talking about COVID, so I believe that's what she's responding to.
Got it. Well, with the COVID relief, the proposal is still being evaluated. It has not yet been approved. Knowing that it is relief funding, we would anticipate them trying to make that decision quickly and push that bill through. So I would say in the next couple of months, but you can definitely, track it by looking at the bill that it's been proposed under in the Access, ACCESS proposal, or feel free to reach out to me and I'd be happy to keep you posted as soon as we know more about that timeline. And then of course, the other FCC program is anticipated out any day now, really in late summer, early fall is what we've been told.
So that's all we have in the Q&A box. However, I have some questions. So anybody that's listening as an attendee, feel free to type in your Q&A. Oh, look, see, we just got another one. Dana, can you go back a slide and share your contact information and leave that up?
Absolutely.
There you go. Okay, so I would like to know, what are some of the more common reasons that you see somebody not getting funded for a telehealth grant, or even a grant that they may be able to use telehealth with? Maybe it's not telehealth specific grant because most of them aren't.
Sure.
But
Sure. Yeah, I'd say the most common errors made are unfortunately the details in either the eligibility requirements or following we always say you follow the grant guidelines regardless of if they make logical sense to you. The guidelines are kind of what you live and die with. So if you go through a grant application set of guidelines, every single thing on there matters. And so the most applications we see returned have been either missing something in the eligibility criteria. You weren't either an eligible entity to apply, or you were missing some of the key registrations or eligibility pieces, or you missed something in the guidelines as a required element of the proposal. So most grants will have several sections that you're required to complete. Most will require a narrative and then a budget justification. Sometimes the budget will require quotes that document, the pricing for which you've asked budget, in your budget for the grant. Those are all pieces that if you're missing even something very minor, it can disqualify you. So the other issue would be is if you're just not meeting their priority areas. So you didn't go to the top of the bucket as far as, meeting all the priorities and getting that extra point for hitting all of their target priorities.
Awesome. So we had a question come in from Cynthia. She asks, any suggestions on how to approach asking for equipment used in the home, such as remote patient monitoring or iPads, and what grants would be more likely to fund this type of technology?
That's a good question. I have a couple of ideas, and it depends on, the type of entity you are, the type of community you're serving. The FCC program in the COVID telehealth, that was a great vehicle for funding that kind of an application. So the home health element was huge in that FCC program. So if you are a nonprofit entity, that would be something to consider. That USDA RUST DLT grant could in some ways fund that type of an application, but with some serious restrictions. Typically that grant looks at fixed locations, and obviously if you're doing home health, you're not going to list all your patients' residence addresses. So we wouldn't want to share that, but you could do something which is called a non-fixed application, which basically requires you to draw a service area. And within that service area, you can have, X amount of devices that circulate through that service area. And that would be a way to do home health. The key there would be that service area needs to be in an eligible area, which means it's rural and underserved. Those would be two avenues to pursue, again, depending on the type of entity you are and where you're looking to serve. If those are not options for you, we could absolutely have a different conversation around some of the HRSA and SAMHSA funding that we have seen that has a little more flexibility around the type of equipment you can ask for.
And I have a follow-up to that. So when you say rural by whose definition? Because there are multiple definitions of rural. So that would be helpful, I think.
A very good point. So for example, HRSA, Health Resources Services Administration, has many programs that focus on rural health care and rural telehealth. They have different definitions of what is rural. So you could be HRSA designated as rural and not qualify as rural for the USDA RUST DLT grant. So that is an important distinction. So depending on the type of grant you are applying for, you just need to check and see what their definitions are. So in the USDA RUST DLT program, any community that's under 20,000 in population is eligible and considered rural. However, you receive more points towards your score if you go more with locations and communities that actually are under 5,000 in population. So in that grant, the definition of highly rural or most competitive for that funding would be serving communities of 5,000 or fewer. But you can qualify at under 20,000. So just to give you an example of what definitions look like, again, those HRSA definitions are different. And those are different measurements based on, USDA looks at census tracts and census lines. I believe HRSA has rural designated counties. So again, that's an important distinction to make and track depending on which program you're looking at.
Okay, so I'm going to ask this next question, and I have to be very careful in how I ask it because, just disclosure time. So the California Telehealth Resource Center absolutely is vendor and company agnostic. We can't recommend one over the other. So when I ask this question, please understand that this is not an endorsement or a recommendation from the California Telehealth Resource Center, HRSA, or any other federal government. Okay.
Jamie asks, to work with or get help from Learn Design Apply, is there a cost? And if so, what would that look like?
And honestly, I'll kind of keep it simple in my answer because it varies. It depends on the type of assistance you want, the type of program you're looking at. If it's simply walking you through, you know, an application that you are completing on your own and just wanting some opinions, that would be very different than if you, for example, wanted to put us on retainer and have us just constantly support you and drive you towards funding. So if you're interested in having a conversation about what that would look like, let's talk offline and have a conversation about how involved you'd like us to be and what options we can provide. But as far as resources like this today, obviously we are happy to share best practices, and our goal at the end of the day is just to help people get connected to this funding. So that part, you know, obviously no charge or no fee, but if you did want us to be more hands-on in that application process with you, I'd love to have a conversation about what that would look like.
Thank you for that. That was beautiful. All right. So I believe I know the answer to this question, but I'm going to ask it. Is there a website where we can check for when the FCC grant becomes available?
Yes, you can actually go to the FCC website. You know, you could just Google search FCC funding, and there's been a lot of attention given to both the Connected Care pilot program as well as this new proposed bill. I see the question that's coming next, and yes, that is the bill where they're actually adding $200 million to the fund. I think it's a total of $400 million in this initiative in the proposed. So yeah, you can go to the FCC. You can also just Google and see if there's any sort of chatter out there about, you know, when it's going to get approved and where to go for it. Again, you're also welcome to reach out to me directly, and I can kind of put you on my list to notify you when some funding programs come out.
So I'm going to skip to the bottom one. Someone said also a website for the DLT USDA grant, the RUS grant.
Yes, I see that there too. That website is correct. It says July 13th, 2020. That was the first round of funding deadline. That has passed, obviously, so those grants were submitted. Again, there was that was a second round of funding in this year, so it's unusual to see two rounds of the same program. But with COVID-19, they did put more money into that program. But you can go to that website to track. Typically, in a normal year, which this year could not be qualified as such, we do see it usually come out late winter, early spring. So they just haven't updated their website yet with those deadlines because they don't have them yet. But it's safe to say probably early next year we'll see some progress with what the new application window will look like.
All right, the next question comes from Anonymous. Are there any funding, is there any funding for returning to school for NPs to focus on telehealth?
That's a great question, and I would say yes. I mean, there's a ton right now under the CARES Act specifically for education. So depending on, again, maybe it might be a conversation we need to have that's a little bit more tailored to what you're specifically looking to do. But around the education space, there's a ton of CARES Act funding being provided to school districts, so K-12 funding, as well as institutions of higher education, that you could potentially access some of those funds for providing that kind of support. In the healthcare education space, you know, I mentioned there are several HRSA programs that we usually see out every year. So I would say the answer is yes, but it probably makes sense for us to have a conversation more specific to what you're trying to do.
We had one come in the chat that asked, what is the FCC bill number? Has it been assigned a bill number? I'm looking at the press release. Looks like it was just released late July. It may not have a bill number yet.
It might not. I can definitely take that as a follow-up item, and I see that as well. Lorna, if you'd like to, or if you're comfortable, feel free to either email me and I can get back to you if I can track that down for you.
Okay, let's see. Can we access successful proposals from the FCC so we have a good guide?
They do provide some details on, if you go to the FCC COVID Telehealth website, you can see what has been funded. They did press releases. I think they did like 17 different award announcements. Maybe it wasn't quite that many, where they do give you some details around what was funded. Our team personally did work with quite a few of those applications. So with permission from those applicants, we would be happy to connect you to people that are willing to kind of share what they did and how they were successful with it. I can't just volunteer their applications to you without obviously getting permission first. You can get, summaries from the website on those projects, but if you want more details, just let me know and I can see if I can connect you to some funded applicants that we worked with.
And the last one I have so far is there any funding available for allied health sciences such as speech, physical, and occupational therapists?
Yes. Again, it all depends on, who you're serving, where you're located, what type of organization you are to look at which kinds of grants we could pursue together. But yes, there is absolutely funding that has those focus areas. I think one thing that's interesting about the USDA REST DLT grant that we talked a little bit about, if you're serving rural and underserved communities, that one has just very broad definitions of distance learning and telehealth. So, you really don't have to have a specific focus area, and anything that you're using technology to bring some kind of healthcare or educational resource to rural and underserved communities, that would be a slam dunk for you in that area. But there are other grant programs out there that do have specific focuses on those types of programs.
Okay, since there's no more Q&A, I have one more.
Great.
So when you're working with an organization, let's say you're working with a clinic, an FQHC, RHC in a rural area, would you suggest that they go after multiple smaller grants, a super large grant? Like, do you have kind of advice on how they should do it? I know a lot of them get a little hesitant about going after a bunch of small grants. So I'm just curious what your advice would be for that.
Yeah, that's a really good question. And I mean, the easy bailout answer for me is that it depends and varies, of course. However, what I would say and argue, when you look at large federal grant programs, especially ones that say fund up to $1 million, if you're a very small clinic and the scope of your project is not huge, usually those large competitive federal grant programs take the same amount of work and effort to apply for the minimum amount as they do for the maximum amount. So keep in mind that even though you might not need a lot of budget, if you're going to go for one of those highly competitive, large federal programs that fund a really high threshold, you're going to put in a lot more work and time into that proposal. So in that case, you may want to look at some smaller, maybe state or local funds, because those tend to be less competitive, less labor intensive, and less tedious. And just keep in mind that those large, big federal programs have a lot of hoops to jump through. And if your project is not very large or complex, you may want to look at some smaller programs that meet your needs, that might not have the same sort of level of work needed into the application. So I would say yes, again, depending on the scope and vision for your project, you could look at smaller programs and kind of pile them on each other if it will take less effort. But the good thing about looking at the large federal programs is that there's consistency, and we know trends in what they find competitive. So even if you were to go for a smaller amount than the maximum amount awarded, there's a lot to be said for the predictability and understanding that formula to getting it funded. So if you have the resources available to put in the time toward a federal grant that's been out, like say a REST DLT grant for so many years, there's a high chance of success if you follow sort of that formula, because you can look at the history of what's made those successful. Whereas local programs that don't come out every single year are harder to predict what they're looking for year after year.
So I have another question. Besides federal websites like grants.gov, what are some good places where people can go to find some of those more local or state grants? Or is there kind of one or two websites that you might recommend?
Yeah, and I can kind of follow up maybe with some lists that might be specific to California. But depending on kind of your area of focus, there will be different agencies at the state level that kind of look, most of the agencies at the state level will have either a funding or a grant section where they highlight, maybe it's Department of Health. We've been doing a lot lately, especially with COVID-19 in the correction space, bringing telehealth systems in place in correctional facilities. In that case, you'd go to, the California Department of Public Safety, and there were a lot of local funds allocated out in response to COVID-19. So go to your state agency website to sort of track the local funds. And again, like our mantra at our company is kind of follow the money. You can do that at your state level and understand where the money is being put into, and kind of how to narrow down by agency where those opportunities are. There's also some, if you look up local foundations, and I'm blanking right now on the actual website, but I can follow up with that information if you'd like. There's a list, listserv kind of like grants.gov, but for foundations. So you can type in certain search criteria depending on your area of focus, and it can bring the list of foundations up that have that similar priority.
Yes, please. We would like to post that along with the slides and the recording of the
Okay,
presentation.
let me find, I'll track it down as a follow-up and I'll get it to you, Rebecca.
Awesome. Okay, and then we had another question come in through Q&A. So Ron asks, only part of our service area is considered rural. Should we be successful in a grant application, would we only be able to use the funding for that part of our service area, although the infrastructure we put in place covers our entire service area?
That's a very good question, and Ron, it kind of enters into a little bit of a gray area. Technically speaking, when you apply for a grant that's specifically to serve rural areas, yes, your budget should support the infrastructure and technology needed to support those rural areas as identified in your project, not the areas that do not qualify. That being said, it's kind of an understanding that, if you as an entity have other locations that you're not included, that there may be some shared infrastructure, but I would just really be careful with how, big of a scope you go. If it's really clear that that infrastructure is going to serve lots of non-rural sites, you will either be disqualified or they will reduce your budget based on, how many sites you're serving that do qualify. So the short answer is, yes, you could get funded, but they will try and quantify every single thing in your budget and make sure it's dedicated to serving those rural areas. Any sort of additional costs, especially on the infrastructure side, that are not to serve those rural areas would technically be ineligible. So depending on how you position it, they might reduce your budget if they feel you're using that to support the non-rural areas. What you could do is fund the non-rural areas internally on your own, and then articulate that in your budget and explain how you are covering those costs independent from the grant proposal, just to keep it really clean and kind of by the book.
Okay, guys, so we technically have Dina left for 13 more minutes. However, I'm not going to force her to stay on unless some more Q&A come in. So I'm going to give you a few minutes to type in another question or two while I ask her another question of my own. So we talked about kind of the really bad, like what's the number one way that you see people not getting their grants. If you were to offer advice to somebody that's not using a grant writer or a service like Learn, Design, Apply, what would be kind of your best piece of advice for them in writing? Is it pulling at people's heartstrings? Is it making sure that, so, okay, go ahead, tell me.
Yeah, no, it's a good question. And I think the very first thing I can't say enough is follow the guidelines to the letter. If you do that, that sets you up as the best possible chance of not getting disqualified. But then to your next question, yes, pull at their heartstrings. But I will say, the most devastating thing is to pour your heart and soul into a grant narrative, pulling at those heartstrings, and then miss something that disqualifies you and know that that grant reviewer didn't even read that heartfelt narrative that you put together because you were disqualified for a technicality. So first and foremost, follow those guidelines to the letter. And then, yes, I would say your narrative, again, should be focused not so much on what it is you're putting in your grant budget, but why. Who are you serving? Why is this so important? And why can't you do this project without these funds? And what kind of impact will it have on the communities you serve? And what kind of changes, positive changes and benefits will your community see as a result of this project? You do want to, these are humans reading your proposal. You want to have them understand, how challenging whatever it is that you're facing is, and don't hold back. You know, we all tend to be a little prideful, especially when we're writing about the places that we live and are from. But if there are challenges, you really want to call them out as truly and strongly as you can, because that's how you're going to make sure that you're compelling and you're at the top of that pile of we need this, and things will not be the same or get better until we get this project underway.
Wonderful. Well, thank you so much, Dana. I really appreciate it, and I'm sure that everybody that attended appreciated it as well. So
Thanks
again,
for having me.
absolutely. So again, guys, the recording and the slide presentations will be posted by the end of the day on our website. We'll get some of those resources from Dina. Those may take a day or two. I'm not going to ask her to be on our timeline, but we will get them up. They will be available on our website underneath the presentation and the slides. So again, thank you for joining us. I hope you guys are able to join us next week, and have a wonderful day, everybody.